chest pain is a very common symptom that patients present to us frequently. When they present to us, actually the most important thing that we want to make sure is that their vitals are stable. So usually what we do is that first we check them first to make sure they are stable. Now, causes of chest pain will vary from, there's a huge variety of causes. The main cause that we always want to make sure that is not a heart attack. Other causes besides heart attack will include gastric, chest infection, and sometimes we do have to consider other things like peptic ulcer disease. Now, how do we further evaluate the patient? We evaluate the patient based on their medical background, medical history. So first we ask a detailed history. Now, after evaluating the history, we do a detailed physical examination, and at the same time, we make sure that they are stable for us to continue the physical examination. Next, we proceed on to investigations. For instance, if blood tests or ECG is needed, we'll go ahead with them. Now, then once we make our diagnosis based on the history and physical examination and the investigations, and then we proceed on to treatment. Now, emergency, the most common and most serious, in fact, one of the most serious things about chest pain causes is actually a heart attack. When we do suspect a heart attack, that's where we have to do things quick and fast. While waiting for our paramedical to come, we actually treat the patient with aspirin, we give the patient oxygen. At the same time, we also give sublingual GTN. That's how we stabilize the patient before we send them to hospital. Now, if we are able to exclude heart attack, then we are a little bit more, we can rest easy a little bit, where we can actually treat other causes which are not so urgent. For instance, gastric, reflux, or perhaps a chest infection that can also give rise to chest pain. Easily treatable depending on what the causes are, especially for chest infection. We treat it with antibiotics, symptomatic relief. Whereas for gastric or peptic ulcer, we might need to, we give pain relief and medication to reduce the acidity. As for long-term prevention, if the chest pain is due to an underlying condition, then definitely we will ask the patient to come back and to follow up with us with regards to screening. And of course, if screening does reveal any long-term medical conditions, we would like to follow them up and treat and to prevent further episodes of chest pain or perhaps any other, at the same time screen for other long-term conditions.
Get connected with us at MHC.